Hey guys, my name is Tim Klingbeil. I'm a paramedic with Cape Valley Health Systems in Fayetteville, North Carolina. Today we're going to be going over hemorrhage control. Due to the COVID outbreak, I'm doing this in my own home, as well as I only have my friend here, Miguel, who's going to be acting as my class. I'm going to be soundboarding off to him so that way I can get him to ask questions about the slides. So the goals today that we're going to go over, identify the need for bleeding control. We're going to also identify what steps to take to control bleeding and the techniques to use to do so. We're also going to talk about the use of tourniquets and bleeding control. The objectives we're going to go over today, we're going to discuss different techniques, demonstrate these different techniques, demonstrate how to pack a wound, discuss the tourniquet in its entirety, and demonstrate how to apply the tourniquet. We're also going to discuss other things to use for tourniquets, such as sticks and belts and stuff like that, if you're in a situation where you don't have a tourniquet on you. There are two types of hemorrhage. There's a minor bleed, and then there's major life-threatening bleeds. Major life-threatening bleeds can be anything from a femoral to a carotid, or even amputation. So hemorrhage control is really important in today's society. Unfortunately, with the increase in active shooters, you do have people dying from things that can be preventable. As you can see, uncontrolled occurring hemorrhage is a preventable death. And major arteries such as femoral can lead to complete loss of blood in less than 3 minutes. With these scenes at such as Sandy Hook, you had people who were laying there for hours on end, bleeding out due to the scene being unsecured and help not being able to get in. But if people inside the scene were able to understand how to control bleeding, there'd be a lot more people alive today because of it. This is a short video about the importance of bleeding control.
Talking about trauma, and no, it's not pretty. It's the fourth leading cause of death in America. And these hands, they're not all that exceptional. But I'd like to talk about a number that is exceptional. I'm talking about trauma. And no, it's not pretty. It's the fourth leading cause of death in America. And bleeding is the number one cause of preventable death following injury. Despite the fact that anyone can control life-threatening bleeding, all you need are your hands and a little know-how. Let me explain. In an emergency, get help. Call 911 or get another person to do so. Now, find the source of the bleeding, cover the wound with a cloth or an article of clothing and apply direct, steady pressure with both hands until help arrives. Once the bleeding is under control, just make sure the injured person is breathing well and comfortable. If you can't stop the bleeding with continuous direct pressure, you can apply a tourniquet if available. If you want to know more, contact the injury prevention coordinator at your local trauma center. Accidents will happen, but they don't have to be deadly, especially if more people like you step up. This really is in your hands.
So that was just a quick video from UCLA Health on the importance of bleeding control. As she stated, it is the number one cause of preventable death after injury. Some of the equipment that if you have on hand, if you're a professional, such as EMS, that you should have, are gloves and eye protection. Eye protection is going to keep your eyes protected from any type of arterial bleed that is going to squirt into your face. It does happen. It will happen. It will continue to happen. So just try to protect yourself from that. Gloves, as always, as a professional, even as a civilian, you should protect yourself from other people's body substances. You also need appropriate materials for bleeding control. So each scenario has their own thing that is going to be the most appropriate thing to use for the controlling of bleeding, and then as well as a tourniquet. So the escalation of bleed control is as follows. You have direct pressure, wound packing, pressure dressing, and then a tourniquet. So anything can happen though. So you can go straight to tourniquet if you need to. The wound packing takes a little bit of time. So if you have someone who's in a scenario where you need to stop the bleeding now and then and just get them out, wound packing might not be the best thing to do. Direct pressure does take some time as well. So if you're in an active shooter type situation, tourniquet is probably going to be your best bet. And then once they're out, then the professional people, such as your paramedics and doctors and nurses, can do the rest as needed. So direct pressure, you're going to use your hand and fingers to directly place them on the bleed. Proper direct pressure can stop even major arterial bleeds. For instance, for myself, I have had several dialysis shunts that were bleeding. You basically just take the left hand, you put them on the little tiny needle prick that is in their skin, and you hold pressure there until it stops. A lot of times with the dialysis shunts, there's a lot of pressure built up behind them, so they're going to appear to be arterial in nature. So just keep that in mind. It's going to be squirting, and using a gloved finger, just one finger, can stop that. You want to do this on a firm surface and nothing soft like a bed. You're not going to be able to get enough pressure on that wound if it's on something that's going to absorb the pressure. And you do not release the pressure to check if bleeding has slowed. If you pull something off to check if bleeding slowed, you can actually pull the clotting factors out and cause it to rebleed. Wound packing. Packing should be considered when the wound is deep or has tunneling. Tunneling is described as like a GSW, where you have that initial impact and it goes through. You want to use the gauze to put pressure on the vessels inside. By stuffing the gauze inside of it, you're making it expand and making it have pressure up against the sides, which slows and stops the bleed from the inside out. You do have Quick Clot, which is the brand that my company uses. And what it does, it actually has a hemostatic agent on it. And if you felt this, you can actually feel that has a little bit of rough consistency and stickiness to it. And that's the hemostatic agent on it. Also, if you notice the blue line through it, that's actually so that way they can pick it up on x-ray. Whenever you get to the hospital, they won't leave it inside. So the wound packing technique, you are going to cut the clothing to identify the wound. A lot of times if you keep the clothing on, you're not going to be able to see the wound in its entirety. So you want to cut clothing to look at the wound. Clean the wound around to identify the extent of the wound. And then you're going to pack gauze tightly into the wound and to the source of the bleed. You're going to use one hand to feed the gauze and the other to hold pressure. So it's going to look something like this. If you can see that, you're just going to force it down into the hole until it's packed in there. You want to be careful of any fractured bones that can cut you, especially if it's like a femur or such. If you're putting your fingers inside a hole, the sharp fragments can actually cut you. So be careful on that. Continue to apply direct pressure with your other gloved hand and apply pressure dressing to provide continuous pressure afterwards. And there's a video that's going to show you a little bit better, which is the actual Quick Clot video itself. Okay. Technical difficulties. Is there any way you can pause them? Okay. So we'll just continue. Basically, you can see how they expose the wound here and the wounds here. They take their quick clot and they just stuff it down in there and hold direct pressure, continuous direct pressure. And at the end, I'll try to find this video again on YouTube, and so that way it'll show you. Okay. I guess the internet's just a little slow this morning because it's coming up now. Give me 1 second. I'm gonna switch this to my phone hotspot. That way it'll be a little bit faster. Okay, we'll just come back to this video. So considerations of wound packing. Do not pack the chest, abdomen, or open skull fracture. Packing the chest doesn't actually do anything other than fill a big void. There's nothing to push up against inside the chest cavity. The abdomen is the same way. It's a very big cavity, so you would just be stuffing a bunch of stuff in there with blind. And obviously open skull fractures, you put pressure on the brain, which is not good. You want to only use on extremities, neck, shoulder, and groin. Those are going to be your biggest uses of wound packing. Keep in mind your neck, shoulder, and groin are known areas for major bleeds due to them being critical vascular areas. There's a triangle of major arteries and veins in both the neck and the groin. And you want to make sure to control and holding pressure. On that groin and neck area, it is kind of unique because if you get up tight deep into those areas that can't have a tourniquet, you kind of have to get creative and the use of holding pressure. One of the ways that you can do is take your triangular bandage and go on one side of the neck, up underneath the arm on the other side, and kind of like tie it. And as you can see, it does apply pressure on that other side of my neck. And that way you still have the good vascular area on the other side for bleeding, or not bleeding, but for circulation. But you're not cutting off full circulation to the head. So some materials you have for pressure dressings. You have trauma pads, large dressings, bulky bandages, ACE bandages, BP cups, and then finally a tourniquet. The thing they put on for tourniquet, basically you're going to use the tourniquet over top of the wound. Not tie it as tight, but definitely hold pressure. And if you have a bag of just various like gauzes around, anything will do. I'll pass this around so you can look at that. This next video is going to show how to do pressure dressing.
What we also want to do is keep the direct pressure. It's more practical for me to tie something here to hold it on behalf of Expert Village. What we want to do in this situation is control the bleeding. We're going to start by taking a bandage or a dressing. We're going to take our dressing, and the first thing we're going to do, if this is our injury site, is hold direct pressure and elevate the extremity. we also want to do is keep the direct pressure. It's more practical for me to tie something here to hold the pressure for me rather than me to use my resources to hold my hand here the whole time. So what I want to do is use something such as Kling. This is a bandage. What we're going to do is put this on there to work as holding the pressure for me. It's important that when you're bandaging, because you're going to be making this tight, you want to make sure you work distal to proximal. Distal meaning furthest from you, proximal closest. So you want to start at the wrist and as you work your way closer in. The reason for this is because since you are going to be making this tight, you don't want to push blood into the hand and trap it there. You'd rather go the other way around if possible.
As you can see, he's using that to kind of put a pressure onto the wound instead of keeping his hand there.
This is dressing right here, and what I can do now is tuck it in by cutting this. What I'm going to show you also are some different ways that you can help make this a little bit tighter, because usually the more pressure you have, the better chance you're going to stop blood flow. You can do something which what we do is you pull it out, and you're just going to rotate the Kling. What this does is going to reinforce this, makes it a little bit stronger, and you can pull harder. By doing that crossing motion, it makes it stronger and less flexible than its normal claw. Again, when you run out of cloth, you can just cut this, and what you're going to do is just tuck it underneath, such as this, eliminating this top part. If for some reason this ever becomes blood soaked, and the blood is coming through it to the point where it's no longer controlling the bleed, you want to make sure that you never take off the dressing, but rather just put new bandages over this one. But you never want to take off the original one once you have it on.
Okay, so basically what it showed was the twist motion in there. What that does is it actually acts as a little bit of a reinforcer. And like you say, you can pull a little bit more taut on those. And it creates a lot more pressure directly onto the source of the bleed. So the difference between pressure dressing and packing. So pressure dressing you're going to use for your limb and torsos. Make sure to apply securely and add direct pressure. You're not going to loosen to check for clotting. If bleeding continues on extremity, you're going to apply the tourniquet and continue to apply pressure and dressings to the distal site. Just because you have a tourniquet on it doesn't mean that you don't need to put dressings onto the wound itself. To add additional pressure on dressings, you can spin the gauze to add more pressure. They showed that technique in the video. So some special considerations for dealing with chest wounds. Chest wounds generally need special care due to the presence of lungs and possibility of pneumothorax. With chest wounds, you want to have a three-sided occlusive. Should be placed on three sides, being shaped, while one side is open, allowing the patient to breathe out, however, not suck air back in. Chest wounds are particularly nasty because you can't really see underneath. They could contain just air, or they can contain blood. So as a medic level skill, you do end up doing needle decompressions. And then on that level, you'll be able to help with pneumothoraxes. So tourniquet it. In the past, during the Iraqi and Afghanistan war, they started experimenting with tourniquets. And they basically said that if you put a tourniquet on early in their stages, that you were going to go ahead and lose that extremity. That's not the case in today's society. You can have a tourniquet up for hours and hours and hours without losing that extremity. The vascular doctors out there now can reattach very minute blood supplies. So it's really not that big of a deal to throw a tourniquet on if you need to and carry on. So when dealing with a massive extremity bleed, do not delay in placing a tourniquet. Early in the slides, we talked about how you can extend, basically bleed out within 3 minutes. So go ahead and put the tourniquet on if you can. You want to place the tourniquet 2 to 3 inches above the wound. Arteries and veins are elastic and will bunch up after being cut. So if you go ahead and put that tourniquet like 1 inch above the wound, it'll actually bunch up the arteries and veins up above the tourniquet, and it'll cause the bleed to be above the tourniquet, which is bad because it'll still be bleeding on the inside and they'll still die. You're not going to place it on a joint such as the knee or elbow because it's not going to be a good place to put it. If bleeding continues after application of the tourniquet, you're going to apply another above the first. So if you have a tourniquet 2 inches above the knee, you're going to go high and tight with the other tourniquet and basically put it up as high as you can and stop the bleed there. Never take off one after the other is placed, though. So a tourniquet in its parts, you do have the wide strap. It's about a 1 inch strap here. The reason we use a wide strap is if you use anything less than this, it's actually going to act as kind of like piano wire, and it's going to cut and pierce the skin. So you want a nice wide strap. You do have a windlass, which is the turning point, and what that does is it actually tightens as much as possible above the injury. And then a method for securing the windlass. If you can look to see here, there's a plastic piece that actually goes to secure the windlass. So I'll pass this around. Any questions on tourniquets?
Certainly, this is a big push in law enforcement. All of the law enforcement officers should be being trained, should be personally wearing, is what I call it, wearing a tourniquet, much the same as you would wear a belt. What you have to have is a wound that would be amenable to the placement of a tourniquet. If the wound is too high up on the body, then there's no way to get the tourniquet between where the wound is and the heart. Okay, so if the wound is here in the forearm, you can put a tourniquet on above that level or even higher up if you want to. And these tourniquets are manufactured specifically for hemorrhage control purposes, have been tested, and they are endorsed by the Committee on Tactical Combat Casualty Care. There are a lot of counterfeit tourniquets out there that don't really work very well at all. And we don't want to use those kinds of tourniquets in this situation. So what we'll do is we'll place this tourniquet around the limb, loosen up this Velcro strap here, tighten this down as best we can above the level of the wound. Okay, then we're going to secure this Velcro on here like so. And then, just like the old Boy Scout windlass and cravat, we're going to turn this windlass until the bleeding stops and we feel that there's no pulse distal to that tourniquet. And then we'll secure this in place, and then we'll monitor the wound to make sure that as the patient improves and the blood pressure goes up, that she doesn't start to re-bleed. We're not going to leave this on for hours and hours. We're going to rush this patient to definitive care at a trauma center, and we'll get control over that bleeding, get rid of the tourniquet, and then restore perfusion to the hand. But right now, there's no blood flow getting in down here because we have this tightened up. So the rule that we use for taking the tourniquet down is at the definitive care site. Don't take it down beforehand. We use tourniquets every day in operating rooms for orthopedic procedures for hours at a time. Our military experience and now our civilian experience would demonstrate to us that several hours of use of a tourniquet to control hemorrhage does not result in significant complications. And our experience with that is we've now got more than 100 patients treated by Gold Cross and Mayo One with the use of extremity tourniquets. And they carry with them a greater than 95% success rate in stopping bleeding.
So as you can see, this doctor basically went over how to use a tourniquet properly and the placement of such. He also spoke on the effectiveness of up to a couple hours and how they use them in the hospital setting as well. So improvised tourniquets should be considered when commercial devices are not available. If you're in a situation and you need to make a tourniquet, you need to understand what it is the parts are of a tourniquet in order to use it effectively. They are notorious for failing, however, and will slow down bleeding until hopefully a commercial device is available. As you can see on the right on the picture, this person used a triangular bandage and as the strap, and they used the trauma shears as the windlass, and they secured it using the triangular bandage here. My videos is just being slow to load today. I apologize for that. While this is loading, where are some of the things you could use for a tourniquet?
Sticks, your shears, belts, triangular bandage.
Some of the things that I would also say is if you had your kit, you could use you could also use forceps and a triangular bandage if you had to. Okay, so we're gonna skip this video as well. For some reason, they're not loading as well as they should. So we have a couple of pictures here, and these are actually two of the pictures of people that I've dealt with personally. This guy here put his arm through a window, and when he pulled back, it actually cut his wrist right in here. What would you do for this type of injury?
Apply direct pressure first.
Okay.
Tourniquet above.
Tourniquet above. Yeah. So this patient actually ended up surviving, but he had significant blood loss before he got there. His blood pressure was 60/40. The LEO that showed up first actually slowed down the bleeding with a improvised tourniquet using his belt as a tourniquet. When we got the reply to actual tourniquet and gave him IV fluids. What would you do for this guy?
Apply direct pressure and then probably a three-sided wound.
Okay.
Three-sided bandage.
Okay. So yeah, it is a chest wound. This guy actually got cut with a razor blade across the chest here. And as you can see, it's a very sharp tool. It almost is surgical, and the fact that it cut directly through the adipose tissue here. It is an open wound on the chest, so you would use a occlusive. We didn't have anything that big. So what we ended up doing was we took our burn sheet plastic, which is about that size, and we use the actual plastic off the burn sheet and taped it down. Our regular Vaseline inclusives are good for GSWs only. So getting creative with some of the things that you need in the back of the ambulance is always good. Be adaptable, and that patient actually ended up surviving. It didn't cut down deep enough because of the sternal plate there to actually do any damage underneath. He was in and out of the hospital in 3 days. What would you do for this one?
Pretty much the same we've been doing. Direct pressure, tourniquet, make sure that, things good to go, stop bleeding.
Okay. For this one, I don't, personally, I probably wouldn't use a tourniquet. I would apply direct pressure. If it didn't slow down any, you could probably use a little bit of, we do have quick clot 4x4s in the bag. So you could actually use a quick clot 4x4, apply pressure for about 3 minutes, use a pressure dressing, and that one might be a little bit easier to do. It looks more venous in nature. Doesn't look that deep, so a tourniquet probably wouldn't be the best bet for that one.
That sounded like now.
What would you do for this?
Direct pressure, indefinite, 3-side occlusive.
Okay. Definitely a 3-side occlusive here. You do have an entry one to the side here. You want to make sure that you keep that third side open for the patient to expand and relax. Also, would you use combat gauze on this to pack the wound?
Could. Or maybe you shouldn't.
I wouldn't, just because it's the chest. What we talked about earlier, if you put gauze in there, it's just going to expand into the cavity up there. So it's really not going to do much for you in that situation. So this guy obviously has a significant injury to the left leg and foot. What would you do for this?
Definitely pressure first. Could tourniquet that. I'm sure there's some arterial damage in there somewhere.
Yeah, I would probably go straight to a tourniquet with this one. There's not really much pressure dressing you can do for this. Tourniquet is definitely going to be your best bet here. How would you apply the tourniquet?
2 to 3 inches above that.
2 to 3 inches above that.
Well, the highest injury at that point.
Okay.
It was a little strange to sit down to someone that you've never met before and decide that you're going to grab their hand and tell them everything is okay.
I screamed. That's all I remember doing at that moment. I knew I was going to write.
I remember feeling like we had to do something immediately right now.
The day started out like any other day. Wasn't cold, wasn't hot. My friend called me that morning and he said, I'm going to take out my Harley and you got your new bike. And so let's just go out and have some fun.
All of a sudden, I see the woman on the motorcycle just flying through the air. I just remember saying, stop the car.
I remember getting thrown head first over the motorcycle. And I heard them say, don't move, please don't move. Blood was streaming down and it went on into the gutter. There's still the mark of the blood.
And then when we pulled up and saw her, blood was rushing down out of her leg and into the gutter. My husband's cousin took his shirt off and immediately started applying pressure to stop the bleeding.
Camille was holding my hand. I remember that distinctly. She said, you're going to be okay. And to hear those words were so important.
I really feel bystanders have a responsibility to act. Don't be afraid. You're not going to hurt yourself. You're not going to hurt the patient. All you'll do is help, even if it's just a comforting hand.
Doing something is better than doing nothing. That helps us more than they would ever realize. That can make all the difference between life and death.
if you imagine yourself in a situation where you've been in an accident, you're vulnerable, you're frightened, think about what you would want.
This video just kind of put a personal touch on it. This lady stopped to assist someone in a car accident and ended up saving and helping out significantly. So even though you don't think that you're doing much by doing hemorrhage control, you are doing something. So at this point, we're going to get into our small groups. And we're going to go over some of the techniques real quick. If you don't mind, Miguel, you grab that bag of gauze and tourniquet, and we'll come right here. I'm going to have you demonstrate hemorrhage control on me. Yep, go from top to bottom.
So with direct pressure, gloved hands, obviously. Just make sure this would be a hard surface back here. And just make sure that you're holding direct, constant pressure. You could also use these devices over here to.
It's balled up.
Yeah. You could just start here. Just keep working your way up. It's a little opened up already, but not perfectly square. Pretty bad for this.
That's why we're going through this class.
Not a medic, by the way.
It's fine.
Okay, now make sure you do the twist in there.
Twist
What does the twist do?
helps apply direct pressure. It gives make more pressure on it.
Okay. So let's say that it's still bleeding. What are you going to do?
We could put more dressing on it, but we wouldn't take that one off.
Okay, and then what after that?
Tourniquet it.
Okay, go ahead and tourniquet. Just pull.
I'm gonna watch you what you do.
Okay, that's good. Okay, and make sure you secure it.
Yeah, make sure that was secured.
There you go. Okay, and what would you do for a wound that's got tunneling?
Tunneling, you could pack that down in there to make sure.
Okay, so use my armpit as, yeah, I put the other one on today.
So you would use one hand to feed while the other hand holds pressure still. So you keep feeding it in while holding pressure with the other hand. You feed it into the tongue.
Okay, good job. And if you wouldn't mind grabbing the charger out of my bag. So we got into our small groups. We went through that fairly fast, but he got the technique down. So that one. And this is what it's gonna look like all together. Probably behind the couch. Haley? Okay. So that last video is not going to play either. So we're just going to carry on. Basically, what the last video showed was what we just did in a small group. It's going to show an active shooter scenario where the guy gets shot in the lower extremity. Someone comes in, they're going to cut open. They're going to wash away some of the blood to see the wound. Apply direct pressure, and while they're applying the direct pressure, they actually use one of their knees so they can free up both hands to open packages. They're going to put a pressure dressing on that wound. And then when that doesn't help, they actually go above and beyond, and they go tourniquet. Once the bleeding stops and controlled, they go ahead and wrap it tight so that way they can keep that wound clean, and they extricate that patient from the active shooter event. So today, that was hemorrhage control. After this, we're going to take a test where we go ahead and test your knowledge. I think it's 15 questions. There's multiple choice, short answer, and an essay. So just stand by, and we'll get that test completed.